Tonight with your health, as DHEC says, they're already seeing some flu cases across the state of South Carolina. This comes right as fall classes begin for students, drawing attention from medical professionals. Our Nate Stanley joins us in studio tonight with more details. And Nate, I know a lot of places already given the flu vaccine out there.
That's right, JR. Doctors tell me although we aren't seeing pandemic level increases in cases and hospitalizations, it's still important to monitor and be safe as we head towards the fall.
But I think it's still important for us to be ready for when the flu does come, because it will come.
Dr. Jonathan Canoka, a medical consultant with DHEC, says flu and COVID season is right around the corner in South Carolina. He says in the last week they've seen a 3% increase in people visiting emergency rooms for COVID-19 infections, adding the state has doubled the amount of hospitalizations from early July. Dr. Scott Curry with MUSC says in 2023 there hasn't been a single month without a case of influenza, and he predicts it will be an early flu season.
So I think we're starting to see a combined effect of crowding inside for air conditioning and all the fun summer travel that we do puts us in contact with some new infectious diseases.
Dr. Canoka says based on countries like Australia, who begin their flu season well before the United States, he expects flu cases to really pick up in November. However, he says the virus is something that should be on everyone's radar before that.
It doesn't mean that it's not a preventable disease, and it's not a disease we should take lightly. Obviously, it still is hospitalizing people. It still is causing deaths.
Ponder Davis, a Columbia resident, says she's been keeping track of the news around the viruses and is prepping to stay safe in the fall time.
And I'm not a close talker to people, and I'm not around a lot of people. I'm not in big crowds, and I do keep masks in my car. So if there's a time when I'm going somewhere and I feel like I need one, I'll go ahead and put one on. I'm going with the flu shot this year. And that's it.
And both Curry and Canoka say the best way to keep yourself safe is to continue those sanitary practices such as washing your hands, covering your mouth when you cough, and getting your vaccines when they are available. Reporting in studio, Nate Stanley, News 19 WLTX.